going to get our public health labs to run 24 hours. We are opening a new one at Ghana East. I'm sure before the end of the week it will be operational so that more people can be tested. We are also encouraging that if you have a reason to test, even for those who self-elect to go and test, because you feel you are exposed, or because you feel like contact to somebody or whatever, you don't feel unwell, once you have that mind, you need to self-quarantine yourself until you see your results. And that is part of an important protecting your own family and everybody else. So it's very important that once you decide you have a reason to test, you self-isolate until your results come in. And when the results come in are positive, you isolate that. So you quarantine and then you isolate. To decrease community spread, we are also getting additional centers. And we want to thank the Pentecost Church for also giving us back the PCC from 1st of February. That will be available so that we are able to isolate more people to control the spread. We will continue supervised isolation of all those who test positive at the airport. That will continue so that we can still mop up people from getting into the system and infecting others. We will continue our quality assurance. We want to ensure that our labs remain in high quality. In fact, as we speak today, there's a team out there visiting the lab to check the quality and standard of testing, not just the quality of testing, but also the linkages to the system, etc., to ensure that we are able to respond as a country quickly. We want to do some seroprevalence to see what is happening in the community, which we've started already. And of course, we expand our collaboration with the GES on education and prioritize communication, especially our engagement with the press, to ensure that we are continue to put the information, and also hope that you also help us provide appropriate information to people to adhere to the protocols. Ladies and gentlemen, this virus is something we also want to promote decongestion. You see, what we don't want is if this thing was to also get into our workplaces, there'll be an explosion. So we're recommending decongestion of workplaces. Those things that can be done virtually, let's do it. Non-essential staff can be doing shifts so that we have fewer people in the offices so that we don't really spread it. Because this virus spreads among acquaintances. If I have it, the chance that I'm going to give it to my family or my friends, the people who meet fast, they are the ones. And so as we learn that, we also continue. We continue working with the schools so that we continue our surveillance to ensure that any outbreak is quickly nipped in the bud. So finally, Honorable Minister, I think I just want to say that this virus is thriving on our very way of life. How we commune, how we worship, everything we do, and that is, as a people, that's what the virus is trying to take advantage of. What the protocol seeks to do is to see how we modify so that we can also defy the trend. So we need self-discipline, and we need all of us to also help us enforce this change that we need so that we can avoid the spread of this deadly virus.